My name is Anna, and I'm a resident in a family practice training program. I've always known I wanted to be a doctor in a small town, and I'm so happy to be in this particular training program as it allows me more opportunities for more rural rotation choices. I also have always been aware that I'm a perfectionist. People have made comments about this my whole life. As a girl, I was so fastidious about my things. My mother never had to tell me to clean up my room. Throughout school, my friends knew I was a serious student, but I don't think they knew how upset I'd get if I didn't score 100% or top of my class. Even then, I worried about things. I really thought that once I got into medicine, I could finally relax and enjoy myself. All this stress, all the worrying was to get to this goal. Once achieved, I thought about my happiness. Boy, was I wrong. The amount of work was one thing, but being around people who were at least as smart as I was and smarter, that was a new experience. By the time I was finishing second year, I was exhausted and questioning whether I could even be a doctor. My clinical clerkship started with a pediatric emergency rotation. There was a traffic accident with 3 hurt children, one of whom was critically injured. I felt so helpless, useless. I was terrified, overwhelmed. I couldn't do anything. And I thought to myself, how can I possibly manage a serious situation like this on my own? I went to see my associate dean. I told him I wasn't sure if I wanted to continue to study medicine. I wasn't cut out to be a doctor. And then I broke down in his office. That had never happened to me before. He was kind, but firm. He told me to see a counselor at the student services, to see my family doctor, and then come back in a week and talk to him again. So I learned quite a bit about how being a perfectionist can be a problem. I learned a lot in therapy, and now I was really looking forward to the challenges in residency. I was being called to attend a delivery of a woman I was following with my preceptor. As I was getting ready to return to the hospital, I was aware of feeling odd. My hands and feet were tingling. I had a strange feeling, uncomfortable at the base of my neck, hard to describe. I shook it off and just thought I must have just strained myself working out the day before. As I was driving to the hospital, I noticed that my hands and arms were shaking. I was aware of my breathing changing, gasping for breath. I decided to pull over, catch my breath, and call the hospital. But I couldn't speak clearly. The next thing I knew, an ambulance had been dispatched. I was glad that it wasn't a serious medical condition, but a panic attack? I had been to therapy. I was happy. I take care of myself. Why did this happen? And now I was so afraid of it happening again. I found myself walking everywhere. I didn't want to drive. I was having problems sleeping. I kept waking up with that same panicked feeling. I didn't want to see people, and I started to avoid them. My doctor had given me a book on panic disorders, and I told him confidently that I wanted to tackle this head on in therapy, no meds. I was depressed. I knew it, but doing something about it wasn't anything I could formulate any kind of coherent plan for. So I did what I knew. I worked more, fairly lived at the hospital. I felt useful there, safe. It took my mind off the rest. I wasn't sure why my preceptor called me into his office. Once there, he talked to me about his concern for my well-being and about some of the changes that he and the staff had noticed. He asked me if there was anything he could do, any way to help. And for the second time in my life, I broke down in the presence of my supervisor. I knew that I had to deal with my problems, and this terrified me. What if this was untreatable? What if this was how I was going to be?